The RADAR trial is a crucial newly diagnosed transplant-eligible myeloma trial. We are due to complete enrollment by the end of this year in 2025, and this is 1,400 patients. There are some outputs that are going to come out this year that I'm excited about. The first is high-risk myeloma patients. The high-risk definition of myeloma continues to change because our treatments are also changing. The high-risk nature is those patients who respond very poorly. So the high-risk definition we used in RADAR many years ago is the definition that's currently being used by the International Myeloma Working Group. So within this trial, we have the ability to talk about how are these patients doing with a treatment combination with almost quadruplet therapy induction, quadruplet therapy consolidation following a transplant, and a doublet maintenance. If this shows that patients continue to derive significant benefit, then we'll have to think about whether bringing in BCMA-targeted agents, how could it further augment for high-risk patients. The second area of clinical output for us in RADAR trial is there are patients who are MRD positive after transplant. The outcomes of these patients are poorer in comparison to patients who are MRD negative. In the trial, we're testing whether just giving lenalidomide or whether you give consolidation and then give doublet maintenance is a better way of converting to MRD negativity, which will then subsequently improve their clinical outcomes. And we'll have results of this part of the RADAR trial this year. So really excited to be able to contribute to the knowledge of newly diagnosed transplant-eligible myeloma, and this will shape some of our clinical practice in the not so distant future.